Today we are here to talk about the new American Academy of Pediatrics clinical report, Adolescent and Young Adult Tattooing, Piercing, and Scarification. And we have here today Dr. Cora Breuner, who is chair of the AAP Committee on Adolescence and the lead author of this report. Dr. Breuner.
Thank you so much for having me here this morning. It's good to be amongst peers talking about a very important clinical report. One of the things I like to talk about with this report is that it came to me when my daughter was 18 and she wanted to get her belly button pierced. And I had no idea how to help her make a decision as to whether she should or not, where she should go. Besides all of my hairs in the back of my neck going up, I don't want her to ever do that, any of that kind of stuff to her body. I recognized that she was of an age that she could make a decision without my consent, so that my best options were to try to figure out how to help her make the right decision and have a safe procedure done if that's what ended up happening, and some forethought into maybe pausing all of that to when she actually was more ready to have this done. So when I went into the literature to try to find something that could help me determine any of these answers to any of the questions I had, I couldn't find anything. I found a paper on complications, and I found a paper on employment and successful interview techniques when you get a tattoo in the workplace literature, but I couldn't find any guidelines that could help me as a pediatrician or help me as a parent figure out what was best for my child. So I went to my committee and I said, we need to do something about this. We need to come together with guidelines for pediatricians and other healthcare practitioners. So my co-author, Dr. David Levine, who is a pediatrician at Morehouse College in Virginia, and I spent a little over 2 years with the help of the Committee for Adolescence writing this clinical report. We had input from all other committees in the Academy, including the section on dermatology, the section on infectious disease, section on school health. There's a lot of other places where we got help in writing this. So this was not definitely mine. It takes a village to write something like this. And sometimes reading a clinical report is like watching paint dry. Because it's so academically oriented and scientific. But this is something that is very important to provide pediatricians and other healthcare practitioners and parents as well an opportunity to know as much as they can about body art and to know about what to do if their patient or their child is considering it. It's broken down, if you look at the report, into a number of sections. The first section is about the demographics of who is getting tattooed or pierced. And basically that has changed considerably over the past 30 years. It was considered something that was done in the military or maybe in prisoner war camps or by prisoners or by gangs, and it didn't necessarily have the best reputation by either the community or other people who got tattooed or pierced, and there was probably more complications then. But now we see that in the younger generations, it's up to 30, 40, 50% of people between the ages of 18 and 30 have some kind of piercing or tattoo. And basically, it's much more accepted in the younger generations than it is in the older generations, both personally for their own expressions and for them who are being taken care of by people who are pierced or tattooed. The second section of the report talks about, it was broken down into tattoos and piercings and talks about technique. So it's actually trying to do as much as we could possibly get to teach practitioners what actually being tattooed meant and what sterile techniques were used for both tattooing and piercing. And the third section is about the complication rates that occur in either tattooing or piercing. It also talks about rules and regulations per state. So each state is different about who's given consent. Some states, most states actually, you have to be 18 and you have to prove that you're 18 to get a tattoo or a piercing. Some states you can get consent by parent if you're over 16 for certain tattoos or piercings. But again, most states it's 18 and up, and most reputable tattoos or piercings will not tattoo someone who's under the influence, who's inebriated from drugs or alcohol. Other things we talk about are people that probably shouldn't be tattooed or pierced, particularly those who are immunocompromised or on medications that will interfere with the healing process from the tattoo or the piercing. and explain why that is, that an immunosuppressant drug might interfere with that. And finally, we spend some time talking about the possibility that future employment could be affected by getting a tattoo or a piercing, especially one that's quite visible on the neck or the face or on the hands. Now, this being said, it is data that is coming from the workplace and from human resources personnel. And this is from data from a few years ago, so that could possibly even be changing in the next 3 or 4 years as the younger generation becomes older and more accepting of this as a form of expression, and not necessarily as a significant indication of unprofessionalism. But still, we don't have that data yet. I'm really, really proud of this report. It's the first one that's ever been done. I'm really proud that the Academy of Pediatrics is absolutely the forerunner in coming up with a clinical report that's basically geared to 18 and up. And so as a pediatrician and an adolescent medicine provider, and as a mom, I feel very proud and excited that this is getting so much press today, and that we are actually providing resources for our pediatricians and other practitioners and parents about making sure that our kids, if they are considering body art, whether it's tattooing or piercing, do it in a safe and healthy way. And I'm so glad to answer any questions if you have any. Yes?
Can you talk about if an adolescent gets a body tattoo, about their vaccine status?
Thank you, Dr. Schifrin. That's an excellent question. That's also very important that we talk about, that basically patients or people that are getting a tattoo or a piercing should have up-to-date immunizations, especially tetanus. When I was doing this research to write this report, I did a lot of going to other salons. I went to many piercing tattoo salons and parlors. And it's really interesting right now. You can actually go to a tattooing or piercing convention. So they're at the big convention centers right now. And the techniques that are used are sterile. The one place where I went, that the piercer used 3 sets of gloves. He changed his gloves 3 times. He asked about the immunization status of every one of his patients. Not all of them do, to be honest with you. It's not necessarily required, but the ones that are excellent and that are trying to follow a standard do. And won't tattoo someone if their immunization status is not up to date. Unfortunately, a lot of people don't know if their immunization status is up to date, so that requires them to bump back into the healthcare establishment, which I think is fabulous. So if there's another opportunity to see a teenager, young adult, yay, because we know they don't come to see us enough until it's too late. About issues they have concerns about. So I'm all for making sure that somebody goes back to the medical establishment to make sure that their immunization status is okay before they do this, as opposed to just going ahead and getting it anyway. Yes?
Along those lines, you mentioned tetanus, but what about hepatitis?
Hepatitis B is also one that we want to make sure that they've had that as part of your up-to-date status. In the report, we talk a lot about complications and how difficult it is to assess actual complication rate. Because when you look at diagnoses and diagnostic codes, ICD-10 codes, it usually will say cellulitis or chondritis or dermatitis, and it won't say due to a piercing, unless somebody asks about it. So that's one of the things I hope this report does for healthcare providers, is get them to talk more about it and ask about what happened. There's a lot of anecdotal reports of hepatitis B and C and even HIV. It's by no means something that people should be concerned about if sterile technique is used, but it is of concern that if somebody isn't using sterile needles or sterile technique, that you could get this. But I don't mean to scare people into not getting this, because it's very, very, very rare. Yes?
You talk about rules and regulations. Do you think there's a role for, what is the role you'd like to see pediatricians sort of, exercise like in their communities? Can they, is this sort of interpreted as, trying, not like a shot across the bow, tattoo parlors, but just like how can they get involved and, and be advocates in their communities?
That's a really great question. I've been asked this question actually quite a bit. Like, why pediatricians? Why should we wade into something when it's more adult, young adult, or up to the parents, really, or up to the industry to regulate itself? And actually, I think it absolutely falls within the purview of the pediatrician, because we take care of kids and want to make sure that they're healthy from the start and all the way through. And so I think that this kind of thing, and this is one of the things that came up as I was writing the report, that most people don't ask this in their well-child visits. And I, as an adolescent provider, am very interested in making sure that we get a full social history with parent out of the room, which would be the HEADS assessment, which is home education, activity, drugs, sexuality, suicide. Those questions need to be asked each and every time a teenager comes to see their provider without the parent in the room. It takes more time, but it actually probably saves time. In those, if you think about that HEADS question acronym, home, education, activity, drugs, suicide, sexuality, there's nothing in there that asks about possible tattooing or piercing. So I think now it should be not another letter, but it should be something I guess it could be in the A of activity, which is, have you thought about getting this? Probably, and we don't know this, I don't think anybody's actually surveyed adolescents to ask them, have you thought about getting a tattoo or piercing at the age of 14, 15, or 16? But I think they have. You can't get away from the television on a Sunday football game without seeing a lot of very, very powerful people, financially and physically, with a tattoo. And then you can't look at a military clip of people defending our country without seeing a tattoo. So they're seeing it. So that when you see something, you a lot of time think about wanting to get one yourself. So, or a music video, or anything, actually, the barista. So I think if we ask about it, then we would be able to provide more information to them ahead of time to make sure that they understand this is permanent. I think one of the things about this generation is the sort of swipe next Instagram model of, I can just dry erase, I can just erase it with some magic formula. And I think the other thing we talk about in the report is that it's permanent. It isn't that way. This is ink that's in the dermis, right? So it's basically, it can't be rubbed off like a temporary tattoo or even a henna tattoo. So the thing I think we would need to make sure kids and young adults realize is that they have to think about the permanence of this, and it's very expensive to have a tattoo removed. Dermabrasion is a technique that's used. It's not as expensive, but it really hurts and leaves a scar. A laser removal, which is totally available, but it's not covered by insurance because it's a cosmetic procedure, could cost anywhere from $400 to $600 to get a tattoo removed. That's 3 or 4 inches high or wide, which is a lot when you think it costs $60 to $100 to get a tattoo on and $600 to get it taken off. Would make you think twice about putting somebody's name on your arm, you know? And kids like to do things impulsively. I understand. I love this population. I wake up and go to bed taking care of these kids. I love it, but they're very impulsive. And so I say, if you're thinking about it, why don't you try a temporary or a henna for just really try putting something on your hand or arm and just see how that feels to just have it there every day, all day, for a few weeks before making a permanent decision like that. Yes?
Let's go to a younger age range. Can you comment a little bit on the training wheels effect of having these temporary tattoos placed on young kids, 6-year-olds, 8-year-olds, as sort of training wheels for when they get older to think about having permanent tattoos? Obviously, we can't do anything about it, but I think it's an interesting point that we are now inculcating younger kids to understand and value tattooing.
Well, again, wonderful question, Don. So I think that when they get it in the Happy Meals and stuff and they just put it on, I know. Those things have been around for a long time, so I actually, I'm not sure. I mean, I remember having that stuff. I remember drawing on my hands, you know, trying to remember, like, or hearts. I mean, I think we've always drawn on ourselves, right? And probably for a long time. So I don't know if we are, it'd be a good study, because I don't know if there are more thoughts about that when we give the temporary tattoos more visibility.
They used to be in Cracker Jack.
Right. I mean, I honestly, it was really interesting because one of the the papers that we refer to was from the workplace survey, which was that 70%, plus 70% of people that have been interviewed felt that having a tattoo or piercing interfered with their potential employment. So it's an interesting, so did it actually interfere? No, but they felt that it interfered with potential employment, so it was a big maybe. And so it being a survey, like a Pew or Harris poll in the survey world, as opposed to a New England Journal article, had a lot of responses to it, comments about this, including why does appearance matter? And really, if this is something that you feel strongly about, why should it matter whether you get a job or not by having something visible? It was fascinating. So I kind of want to unwrap that a little bit more, probably with Dr. Breuner back there, trying to figure out a little bit more about why does it matter at all whether someone gets one. But that's a whole nother world. It's not necessarily a pediatric world, but it's a workplace world. But I do honestly feel that we as pediatricians, our job is to make sure that those who we are charged to provide care for get, and their parents get every ounce of information they can to make an informed decision. And a firm no, you can't do that, pretty much will drive a kid to doing it. So I absolutely don't condone that at all. I know when I went with my daughter to get her belly button pierced, she was holding my hand. I mean, I made sure everything was up to snuff and good enough, and then she held my hand. I thought she was going to snap my hand off. I mean, that hurts, apparently. I don't have it. But she was really glad I was there. She's super proud of it. She's 23 right now. And I totally asked her if I could talk about this today. And she said yes. And she said, I was glad you were there, Mom. And I'm glad you're a pediatrician and you're talking about this stuff. Because if you don't talk about it, it just goes underground. And people just think it's some dark alley. And it isn't at all. And so, and it's not just, I know peers my age that have thought about getting tattoos. So honestly, if this opens a discussion for everyone about this, I think it brings all of body art and really trying to have self-expression in a world where we're all very much tied into talking to each other, into a place where we can have a viable conversation about a healthy way of doing something like this. Yeah?
Can you talk a little bit about the line between self-harm and
Yes, that was in the paper as well, that NSSI, non-suicidal self-injury, that was, it's definitely been not considered a form of self-harm. When they really did surveys on asking people who were pierced or tattooed whether or not this was a self-injury expression, non-suicidal self-injury, and it's definitely not that. So it's a myth that we really want to dispel, that people that do this aren't trying to cut or hurt themselves. They, possibly some are, but the majority of people, it's not that. So when you see someone with 7 or 8 piercings in their ear, it isn't a cry for help, I guess is what I'm trying to say. It's a form of expression that they want to be seen as someone that likes to have piercings and likes to express themselves. So, it's still a concern because you really want to make sure that it's not infected and that the piercer used sterile techniques, but you shouldn't worry that there's something you're missing necessarily in someone like that. Yes?
Can you please summarize the advice that you give to your patients in your practice in that couple of minutes you have to talk to them about it?
Well, wow, such an excellent question, because we have like 30 seconds to cover 400 million things. I know. Like not texting and driving and wearing a helmet and safe sex and nonviolent sex and LGBTQ and sexual identity issues and, oh yeah, go to school and get your hepatitis and your HPV vaccines. And let's talk about tattooing and piercing, which is the one thing they actually probably want to talk to you about, right? All the rest is like, yeah, I know. So I think they're used to being talked to in 140 characters or less, right? They're used to this quick. So if we can do it quickly, I think it would be super important. So open-ended questions are really important for teenagers, which a non-open-ended question would be, you don't want to get a tattoo, right? Closed. So do you have any questions about body art? Which would mean, have you any questions about body piercing or tattooing? Like, that's just an open-ended question. And if they say yes, which again, probably 60 or 70% are going to, and that's what I really want to make sure that pediatricians and other healthcare providers get ready, because if you ask this question, they're going to say yes. Immunization status, have you thought of a place you're going to go? You need to make sure you're 18. And what medications are you on? Are you aware of complications? And finally, are you aware of the permanence of what you're doing? And that getting it removed is very expensive, or having a piercing close is quick. So if you have a nipple piercing, it's very quick that your nipples are going to close up, and it would take another piercing to get them to open up again. And so for some of my young adults who are thinking about having a baby and breastfeeding, I say, okay, if you're going to get that done, the piercing jewelry has to come out when you're breastfeeding. And it's going to close right up. So you're going to have to get your nipples pierced again after you breastfeed. Same with your belly button piercing. Once you're pregnant, it's very, you can keep it in, but if you have a C-section, it has to come out. The jewelry has to come out, and then it's closed. Tongue piercing, same thing. If it's out, it's pretty much closed within about 12 hours. So it's important to talk about that. It's also important to talk about healing time. Time to get a piercing or tattoo is probably not in the summer when you're going to be out in the sun, because it's going to scar and be darker, especially in people of color during the summer months. So if you're going to get a tattoo or piercing, you probably should do it during the winter, with the exception of navel piercings, because that takes about 9 months to heal. So if you've got tight pants on and you're really covered up in the wintertime, it might take longer. I try to say it as like that fast, which was about 2 minutes. And people say, well, it's too fast, kids can't get that. But I think the biggest thing I do, and Megan's going to attest to that too, is we do a repeat back all the time in clinic, which is, tell me what I just said to you. And that's really hilarious, because all the stuff about don't text and drive, and then they go, I don't remember what you said at all. I wasn't listening. But if you talk about the complications of a tattoo or piercing, they go, oh, okay, I need to go to a sterile salon. I need to make sure it's the right decision. I know it's expensive to get in. I know what complications. I need my immunizations. I need to make sure I'm not on immunosuppressant medication. Yeah, got it. I'm like, okay. But that's a great question. Thanks. Any other questions? Yes, Megan.
Can you comment on the timing of this report and why it's important to have out now?
That's a great question, and I've been asked that question, like, why now? Why do this now? And again, for me personally, it was because of what I noticed. But I honestly think that it's much more prevalent than people realize. And now that I've done it, I don't know about you, if you've read it already, wow, right? It's like everywhere in the airport. I mean, you just start, I just start seeing it. And I realize this is something, it's a really good time to talk about it now when when it's more visible. And I think that news right now is being read more now than I think ever, which is great. An informed person is a smarter person that makes more conscientious and thoughtful decisions. So I think that now is the perfect time for all news, really. It's hard to read all of it. I'm fascinated before I go to bed. I used to just kind of drift off to sleep, but no, I have to check whatever's going on. So I think now is a really good time from that. And I think pediatricians should be doing it as opposed to the other healthcare providers, I think, because it really is something that kids are thinking about at a much younger age than I think we realize. And parents really, I know they've got a lot going on thinking about these things. But since I've written this, I've had so many people ask me, wow, now what do I do? And I've been wondering what to do with my kids who are thinking about this. And they come back from college and all of a sudden they have a septum piercing or a cartilage piercing, or they suddenly got a tattoo. How'd they get a tattoo without my permission? Well, they're over 18. And so they're upset because they didn't know their kid was thinking about doing that when they went off to college. And you can seriously imagine how frustrating it might be for a parent if a kid does something like that without their knowledge. Not that they need to know, but I think if it already happened in the pediatrician's office or the healthcare provider at an earlier age, then I think that the child would be more comfortable as they went into their teenage and young adult years to have that conversation with their parents and their providers. It was just brought up sooner. Because I think honestly, do people regret getting these? And I think most don't. If you really drill into do you regret your tattoo? And most people say, I love my tattoo. I love my piercing. Like love, that's a big word. But I think it's kind of interesting to hear that. And I think as a parent, it would be nice to be involved at some level into having your child make a decision about something that they love. So I think now is a good time for this. That's it. Thank you very much for coming. I appreciate your time.